Hello guys, I'm gonna try to record this session. It's gonna be about joints or articulations. We have the joints or articulations. It's the same name, and they are the functional junctions between the bones. Then they band parts of the skeletal system together. They make bone growth possible because when we have the bones and we have this space, this is going to be allowing the growing in this way, in this direction. Then permits parts of the skeleton to change shape during the childbirth and enable body to move in response to a skeletal muscle contraction. Think of it. If you have the skeleton, are you able to move the skeleton if you have no joints? It's not possible. You need the skeleton, you need the muscles, the attachment between the bones, and you need these joints between the bones in order to be able to be moving, guys. Then the classification for joints is regarding the structure and regarding the function. Regarding the structure, we have fibrous tissue, cartilage, and synovial fluid. We're going to be talking about that later on. Then again, we have fibrous joints, cartilaginous joints, and synovial joints. This is regarding the structure. And regarding the function, we have, depending on the movement, not movable at all, which is synarthrotic. We have slightly movable, which is the amphiarthrotic. And we have freely movable, which is the most of them are diarthrotic. Again, we have, regarding the movement or the function, we have not movable at all. They are called synarthrotic. We have amphiarthrotic, slightly movable, and we have diarthrotic. Regarding the first one, regarding the structure, we have here joints made of fibrous tissue, connective tissue. Then the fibrous joints are held together because the dense connective tissue. Remember, we have ligaments, we have tendons, we have aponeurosis, and we have fascias. All of them are made of dense connective tissue. And they contain many collagen fibers. They are found in bones in close contact, usually long bones. Usually we have two bones. When we have this example, maybe in your forearm or maybe in your leg, you have the tibia and the fibula, or in the forearm we have the ulna and the radius, and then between them we have a ligament. This is the case for the leg or for the forearm. And these fibrous joints are divided in syndesmosis, suture, and gomphosis. These specific cases for syndesmosis, again, it's the union for dense connective tissue between two long bones. It's the interosseous membrane or a ligament. It's a ligament, and this is slightly movable regarding the movement, regarding the function, and this is going to be again between the tibia and fibula or between the radius and ulna. The other kind of fibrous tissue, the fibrous joint, is going to be the suture, and you remember this because of the skull, and the suture is between flat bones of the skull. And you have then the parietal bone, you have this suture. Between the parietal bone and the occipital bone you have this suture. Between the parietal bone and the temporal bone you have another suture, and between the parietal bone and frontal bone you have another suture. This is a thin layer of connective tissue, but usually this is made of cartilage when we're kids, when we're newborns and infants, and after that, after 2 years old, this is going to be a bony union, a bony joint, and then it's going to be the suture. And finally, we have the gomphosis, which is the cone-shaped bony process in a socket in the jawbone. It's a union between the maxilla or mandibule with the teeth. Then this union is called gomphosis. After that, we have the joints made of cartilage, and these could be two kinds: synchondrosis and symphysis. Synchondrosis, they are made of hyaline cartilage, and we have, for example, the union between the ribs and the sternum. These articulations are made of cartilage, the hyaline cartilage. Then they are called synchondrosis, and they are slightly movable. And then we have the symphysis, and the symphysis, it's the cartilage is going to be fibrous instead of hyaline cartilage. Here we have hyaline cartilage. In this one we have fibrocartilage. And two main examples are the pubic symphysis here and the intervertebral ligaments we have here. These discs are made of fibrous cartilage. Then between vertebrae we have these articulation between vertebrae, and these are made of fibrocartilage. Finally, regarding the structure, we have the most common joints we have in our body. These are the synovial joints, and the structure for the synovial joints is going to be always 4 elements, at least 4 elements. It's going to be the outer layer, the outermost union is going to be the capsule, and it's made of the fibrous capsule. And then we have the synovial membrane, which is the inner lining for the articulation. Then we have a cavity, which is filled with liquid, with fluid, which is the synovial fluid. And finally we have the covering or protection for the bones, which is the articular cartilage or articular surface. Then we have the articular cartilage, the capsule, the synovial membrane, and the synovial fluid and cavity. These 4 elements are always in our synovial joints. These ligaments could be or not in the and these other elements, they could be or not. Usually we have this in big articulations such as elbow, hip joint, and the knee joint. Then we have the general structure for the synovial joints between long bones usually, and then we have this major joint, which is the knee joint, and here we have again the capsule, and then we have the lining, the inner lining, which is the membrane. We have the hole or the cavity filled with liquid, with fluid, which is the synovial fluid. And we have the cartilage, hyaline cartilage, which is covering the bones, which is the articular cartilage or articular surface. But some of them, they have another structures, such as meniscus or bursae. These are for protection. These are for avoiding friction. These are for special structures in order to avoid damage in the joints. Regarding the type of joints, we have 6 types of synovial joints. We have the most common one is going to be ball and socket, which is the freely movable. Usually it's going to be a diarthrosis. It's called as well an spheroidal joint. It's the round head in a cup-shaped cavity. We have some examples, could be the shoulder or glenohumeral joint, or another big example should be this one, which is the coxofemoral joint. It's the widest range of motion. It's multi-axial. You can have here flexion, extension, circumduction, and it's almost every single movement you have available. The second kind of joint is going to be condylar joints, and these joint is going to be frequent between the metacarpals and phalanxes. It's also called ellipsoidal joint, and it's going to be 2 axes. It's going to be laterally and flexion and extension. The other joint is going to be the plane joint. This one is the fake one. Always you have all the elements. These ones are missing some elements. It's also called the gliding joint, and it's usual only in two parts, the carpals and the tarsals. Then we have a famous joint, maybe the most related joints with the term, the articulation, is the elbow joint and the knee joint. They are the hinge joints, and they are uniaxial. They have only one axis. It's going to be only for flexion and extension. And some other joints, we have the elbow, we have the between phalanges, and we have the knee. The knee, it's a modified joint. This is a common joint as well, the pivot joint, the pivot. It's going to be between a pivot, as you can see here, and it's going to be able to rotate the joint. Then it's going to be able, you're able to say yes, because the condyles between the skull and the atlas, and you're able to say no with your head because of this rotation movement between the atlas and axis. Then the pivot joint is going to be between the atlas and axis. And then we have the saddle joint, and the saddle joint is, if you remember, it's going to be like a saddle like this one. Then this is going to be only one example in our body between the carpals and the first metacarpals. Regarding the joint movements, we should be regarding these all movements: the lateral flexion, the extension. It's going to be different for every single segment of the body. Abduction, abduction, away from the midline, and adduction toward the midline. Then we have dorsiflexion and plantar flexion. We don't have extension for the foot. We have only dorsiflexion in this way and plantar flexion in this way. If we need to stand on our tips, it's going to be plantar flexion. If we need to stand on our heels, it's going to be dorsiflexion. We have circumduction, the rotation we have for the shoulder and the coxofemoral joint or hip joint. We have medial rotation and lateral rotation, and we have supination and pronation. Remember, if we can hold sup, we have supination, and the other one is going to be pronation. For our foot, we have as well inversion toward the midline and eversion on the outside or away from the midline. We have protraction and retraction, elevation and depression. Some examples of synovial joints, the bigger ones, are the shoulder, the elbow, the hip, and the knee. You must know some specific structures, such as the ligaments you have here, and the location of the main elements. Again, it's going to be the capsule, the synovial cavity filled with fluid, the synovial membrane, and the articular cartilage between them. One of the most movable joints, it's a shoulder joint. Then we have these major ligaments for the shoulder, and you must know it. You must be able to identify these three ligaments: the coracohumeral ligament, from the coracoid apophysis to the humerus, from the glenoid cavity to the humerus, and the transverse humeral ligament. Then you have the elbow. Remember, this is going to be a modified hinge joint. And again, you have the main elements. You have the capsule, you have the membrane in blue, you have the fluid in the cavity in light blue, and you have in white the articular cartilage, or the articular surface made of hyaline cartilage. And regarding the ligaments, you must know the location of the radial collateral ligament, the radius, the ulnar collateral ligament, the ulnar, and the annular ligament, which is this one. The hip joint, is another one which is important, and the other one which is important is the knee.